Welcome back to another episode of the Interesting MD podcast. I'm your host, Rob Beck. I have with me today the Health Minister of BC, Minister Josie Osborne.
Thanks so much for having me. What a novel format to be able to talk about a really important topic.
Now, the reason that I did want to have you on is because of this new policy that you guys announced and this new policy that you were pushing. Would you mind just kind of telling us about the policy about U.S. physician recruitment?
Absolutely. British Columbia, like jurisdictions around North America, and in fact, I would say, pretty much around the world, are experiencing a shortage of healthcare workers, be it physicians, nurses, but many other kinds of healthcare workers as well. And, it shows in the wait lists that people are on and the time that it takes to access a family physician. That's really tough on people. And we are taking every step that we can to increase and strengthen the healthcare workforce here in British Columbia.
Welcome to the Interesting MD podcast, the show about what doctors do when we aren't seeing patients and how this can help us find balance and prevent burnout. I'm your host, Rob Beck. Welcome back to another episode of the Interesting MD podcast. I'm your host, Rob Beck. Today is the second episode in a series I'm doing about U.S. physicians moving to Canada and specifically British Columbia. Last week, I spoke with Dr. Paul Hertz about the structure of the single-payer healthcare system and about the quality of life a physician might expect here in British Columbia. This week, I am speaking with a very distinguished guest who can tell you all you need to know about how to become a doctor in British Columbia. I have with me today the Health Minister of BC, Minister Josie Osborne. Minister Osborne, thank you so much for coming. I cannot thank you enough.
This is great. Thanks so much for having me. What a novel format to be able to talk about a really important topic.
It's a very important topic these days. Thank you so much. We are going to get to the part where you tell us all about the new policies that you're putting into place and how to bring doctors here. But I did want to ask, if you wouldn't mind, just tell the audience a bit about yourself and how you ended up as the Minister of Health of British Columbia.
Yeah. How to compress all these years into a very short story.
Yes, I know that is a very long conversation. So
I've been the Minister of Health here in British Columbia since November in 2024, just after our provincial election here. It's my second term serving as a member of the BC legislature and a real privilege to become BC's Minister of Health. I live in a very small town called Tofino on the west coast of Vancouver Island, and I've been there for over half of my life. And I first moved there to work as a fisheries biologist. So I trained in marine biology. I did a master's degree in resource management. I moved out to the west coast and I worked in Indigenous communities. I worked for the Nech'Aleth Tribal Council, a local Indigenous government, and really fell in love with that work, really community-based work, learning about a whole new way of looking at the world. And became really active in my community, eventually became the mayor of Tofino and really loved that public service aspect of this kind of work and serving people, helping to solve problems. And with my background in the ecology and biology, I really love the systems view of the world and really looking at the interconnection between the way in an ecological system and now a healthcare system and how it functions and what we need to do to make really positive changes that people can really feel on the ground. So it's a pretty interesting background, I think, to have to come into this position as Minister of Health. And I'm just really delighted and very privileged to be able to do this work.
Well, we're so glad to have you, and thank you very much. And I started my career as a field biologist as well. I worked with endangered species of bats, kind of in the western or eastern U.S., so kind of everything east of the Mississippi. So did a lot of field work out there. So I think that we had a lot of shared experiences and probably both agree that we don't really want to be out in the field too much anymore doing sample collections. I would imagine that's pretty hard work.
We'll just do it recreationally.
Right. Recreationally, that's fine. Doing it as a living, that was a little bit tough. I mean, in addition to this, I was reading that you have held a lot of other ministry positions. Is that right?
Yes, that is true. So over the past several years, I've been the Minister of Municipal Affairs. I have served as the Minister of Land, Water, and Resource Stewardship. And then most recently, the Minister of Energy, Mines, and Low Carbon Innovation. So it's a bit of a switch to come into health, a much more social service oriented ministry, but one that is so full of heart and hope. I just love talking with frontline healthcare workers, be they physicians or nurses or diagnostic technicians or people who serve food in hospitals and other facilities. It's such an amazing system, and the people who care so deeply that it's one of the most inspiring parts of this work.
We are, again, very lucky to have you here, and also very lucky to have you fighting for us here on the front lines as well. So thank you very much. Also sounds like you've got a pretty good idea of how the inner workings of the British Columbia government, how the government operates. That'll help out with a lot of these policies here. Now, the reason that I did want to have you on and am really appreciative of you coming here is because of this new policy that you guys announced and this new policy that you were pushing. Would you mind just kind of telling us about the policy about U.S. physician recruitment?
Absolutely. British Columbia, like jurisdictions around North America, and in fact, I would say, pretty much around the world, are experiencing a shortage of healthcare workers, be it physicians, nurses, but many other kinds of healthcare workers as well. And, it shows in the wait lists that people are on and the time that it takes to access a family physician, and in many cases, even to have a family physician. That's really tough on people. And we are taking every step that we can to increase and strengthen the healthcare workforce here in BC. So we've opened, or we will be opening, I should say, in 2026, a brand new medical school, for example, here in BC. But that takes time to train new doctors, right. And with more nursing seats, it takes time to train new nurses. We also know British Columbia is a fantastic place to live. We have seen record amounts of immigration to our province in past years. And now what we're doing is taking a really targeted approach to recruiting US-based physicians, nurses, and other healthcare workers, and extending the invitation to say, hey, come to British Columbia. This is a wonderful place to work. We have a single payer, universal public healthcare system. We have incredible communities where people live. There are many different opportunities for people to practice medicine or their healthcare profession. And so we're taking a very targeted and specific approach to inviting physicians and others from particularly the West Coast of the US. And we know that one of the challenges people face when they want to change jurisdictions is being licensed. And so we've been working with our British Columbia College of Physicians and Surgeons to reduce those administrative barriers and make it simpler and make it faster for physicians to be able to practice here in British Columbia.
Absolutely amazing. And I think that anything that you can do to streamline that process is great. And sorry, I'm an American. I also am a Canadian now, but I still say process instead of process. So sorry, you'll have to be bilingual here with me. So what prompted this policy shift?
Well, yeah, I think that sometimes when something becomes urgent, it's when you really take a careful look at something and say, do we really need to have all of the process in place that we do? And can we make this simpler and faster? Of course, the public interest and patient safety is utmost, and we never want to compromise that. And we know that when people are trained as physicians or nurses in other jurisdictions that have, similar education systems and are trained to the same standards, that there is some paperwork clearly that's involved in proving that experience and that education. But it didn't have to be as onerous as it is. And that's why working with the college to enable US trained doctors, and particularly those who hold certification with the American Board of Medical Specialties, make it really easy for them to become fully licensed here in BC without the need for further assessment and examination, taking more exams or training or, that kind of proof piece, that we could make this simpler and faster for doctors and nurses and others. And that's exactly what we're doing.
That is fantastic. Given everything that I and my wife had to go through, this will be, it's a huge relief. It's great to hear. And I think that this is going to be great. So what kind of physicians are you recruiting?
Well, anybody is welcome, I have to say. Particularly though, of course, family physicians. We see gaps in our primary care system and particularly in rural and more remote communities, and love to talk a little bit more of that. But all specialties are welcome. And there are certain specialties I think that are ones that are more likely who can find work here in British Columbia. And again, that's a really important part of it, which is finding the right fit. And so part of this work is not just, sign up to healthcareers.ca, which is the portal that we use, which will connect a physician, an interested physician, with our health match program and get you in touch with a person who will be able to explain the process and work with each person on an individual basis. But then also, exploring the opportunities that are available here in British Columbia and finding the right match. I've had the opportunity to talk with a lot of different communities, with physician organizations here in British Columbia, the divisions of family practice, as we call them, for family physicians, but also speaking with, consultant specialists at British Columbia, for example. And everybody says the same thing, which it's very important to find the right match. So you have a person who is willing to bring their family here to British Columbia. You want to make sure that the job is the right job, but also that the community is the right community. It's the right facility, the right place for you to be.
Wonderful. And I just heard the Coho. So obviously you're downtown. I heard the Coho ferry horn leaving. So.
Yep. For the listeners and watchers at home, that is the Coho Ferry, which connects our two countries between the states. And you can come up from Port Angeles to Victoria by the Coho Ferry. And I'm sitting in my office at the legislature. And so, right time of day, you get to hear the horn.
It's beautiful. All right. So how many physicians are you hoping to recruit? How many positions are available? Do you have a number?
We know that there are a lot of physicians who are at or nearing retirement age here in British Columbia. So honestly, we are just hoping to recruit as many as we can. And as I mentioned before, particularly in some of our more rural and remote communities, but urban communities as well, there are opportunities, I think, for a fit for just about anybody. And I mean, since we announced that we were going to launch this recruitment campaign, we've already had over 1,100 inquiries through the Health Careers portal, which is just phenomenal. I mean, we haven't even put an ad out yet at this point, and we're speaking here in early May. People will see those ads coming down to the States in May, and we're already getting all of these inquiries. The response is phenomenal.
That's pretty amazing. And it seems like there is a lot of interest for sure. And it's really great because this new policy is going to make it much easier and make it a much less onerous process, which is hopefully going to bring a lot of results here. Will there be any restrictions to the licenses?
We're still working out these final details with our college. They're actually going through a process right now of amending their bylaws, because they are the ones that need to do this in order to streamline the licensure pathways. So those details will become available very soon, but we don't envision any U.S. certified physicians are going to face any particular or special limitations to their practice. And again, the whole point here is to make this simpler and faster for U.S. certified and trained doctors to be able to come and practice here in BC.
Are you able to outline the process for physicians? So they hear you, they say, okay, now I believe it. I know what a single payer healthcare system is like now after last week. Now I am interested. I want to sign up. I want to start looking. So, and get in, and I want to do it. I want to pull the trigger. So how do they do that? Are you able to explain the process?
Yes. And it is quite simple right now. You go to the website, the portal, which is bchealthcareers.ca. Through there, you can register for an upcoming Team BC webinar, and we'll be hosting those in May. You'll get a lot of great information about our health system there, learn specifically about those job opportunities, and we can connect interested physicians with a navigator at Health Match BC. So this is a person specifically who will be able to speak to each physician who's interested and talk a lot more about the process and answer a whole range of different questions for physicians.
Okay, so bchealthcareers.ca.
You got it.
That is where you start. Okay.
That is where you start.
All right. So once they become licensed, they start working here. Has there been any thought about continuing medical education and the need to maintain certification? I know that most of the doctors here most of the U.S. doctors who move up here won't be able to sit for the Royal College exam, at least at this time. And so they wouldn't be certified under the Royal College of Physicians and Surgeons, but they would be under the BC College of Physicians and Surgeons. How would that maintenance of certification, how would that work?
Great question. So maintaining certification down in the US won't be a requirement after registering with the College of Physicians and Surgeons here in BC. But, similar to all the practicing physicians in BC, a US trained and certified physician will need to follow the continuing medical education requirements that are set out on the college's website. So, be just like anybody else who is certified here in BC. And of course, as everybody knows, these are requirements that help physicians stay up to date with their practice and continue that really high quality care that's delivered to patients. We have taken some additional actions that will help US trained physicians too by establishing what we call an associate physician role that allows internationally trained physicians who don't have a direct pathway to licensure here in BC to practice under the supervision of a fully licensed physician here. And we've had over 90 international medical graduates become licensed this way. We have another program here called the Practice Ready Assessment Program, and it provides a internationally trained physician with a different pathway, a different route to full licensure here in BC. And we have international medical graduates who are coming literally from all over the world and are able to practice here in the province. But for those US certified and trained physicians, again, you just become a member of the college and subject to the same requirements that anybody else would have here.
Okay. And I will say that from my experience going through the Royal College Maintenance of Certification, that is not very onerous at all. It is much better than it was with the American Board of Internal Medicine. I'm not getting paid to say that, but it is a much easier process, and there is no requirements for further examinations, for further testing, which is really important to U.S. physicians. There's either yearly things that you have to do or every other year, very expensive things that you have to do in the United States, or every 10 years you have to retake the internal medicine exam, which is not probably the best use and most relevant. And so we have had no problems with compliance with MOC. There are 3 different ways that you can get it and 3 different categories that you have to be in, but they're very, very easy to do. And so I find this to be a very reasonable, not onerous process at all. So
good to hear.
Yeah, that's great news. So that is very good news. At this point, what about immigration? How would doctors and their families obtain the right to live and work in British Columbia?
Another great question. The BC government administers an economic immigration program that's called the BC Provincial Nominee Program. It's the tool that we have. In fact, it's the only tool that we have to directly select skilled workers who can help address different kinds of labor shortages and needs here in the province. And so those who are nominated can apply to immigration. And this is run through our federal government. So it's that division of responsibilities between the province and the federal government here. So it's Immigration, Refugees, and Citizenship Canada that is the agency people work with for permanent residence. We are focusing our provincial nominee program specifically on nominating healthcare workers who are going to be able to contribute directly to delivering healthcare services here in BC. So I recommend for any physician interested, to learn more about how you and your family move to BC. Again, go to BC Health Careers, and some of the information will be there. It'll direct you also to welcomebc.ca and include all of the information that's required for families and people. Mm-hmm.
So once again, bchealthcareers.ca. And what was the other website? Sorry.
That's welcomebc.ca.
Okay, welcomebc.ca. Welcomebc.ca. Getting started with all of this, they just go to the websites, they sign up, they get all the information. That's all they need to do.
Yeah.
Right?
You can take a webinar. You can be matched with a navigator, with a person who can help you move through the system.
You're trying to make it very simple, and that sounds great. All right. And finally, is there a message that you have to reach out directly to U.S. trained physicians who are watching this right now and are maybe on the fence, or maybe just any message that you might have?
Well, I think our message to people is really clear, which is that British Columbia is a wonderful, warm, welcoming place to live. Our single-payer public universal healthcare system, I think the values behind our healthcare system here really match the values of why people choose to go into medicine and to serve communities, to serve people. And we are ready, willing, and able to welcome. We are removing all the barriers that we can to make it easy for people to come here to British Columbia. But, when I talk to physicians who have fairly recently moved to BC and I ask them questions, they've got good questions too. They're very interested in different kinds of communities, the education for their kids, the childcare opportunities, work for their spouse. And often, healthcare professionals it seems to be that they're often together. But what I hear from people who make that decision is that they are so grateful to live in a place where there are so many recreational opportunities. This is such a beautiful and diverse province. And whether you're into skiing or mountain biking or sea kayaking, or you just want to find a really welcoming community to raise your family and feel a valued part of that community, that's what seems to really draw people here and help them stay here. Our commitment is to do everything that we can to make it as easy as possible for people to come here and be part of our healthcare system. And in return, I think that people will find incredibly welcoming communities and beautiful, wonderful places to live.
It could not be said any better than that. It is a wonderful place to live. And if you come here, BC will sell itself. I can tell you, I had never actually been to British Columbia until we moved across the border, until we drove our U-Haul across the border. Because of the quarantine requirements, we just bought a house and then moved up here, and we're happy to be here. And we have not regretted it. So this has been great.
Story. Really great story. Oh, what a delight to talk to you. Thank you so much.
Thank you very much for taking your time. This, once again, Health Minister Josie Osborne, thank you very much.
So welcome.
There we have it. That's the interview with the Health Minister of British Columbia. Guys, I will say that I have no real right or business to have the Health Minister of British Columbia come on to this very young, very small podcast. But it illustrates so many things that I want people to understand about being a doctor. If you can tolerate rejection, if you can tolerate somebody saying no to what you think is a really great idea, there is no reason not to ask. A couple of months ago, I emailed the minister when I saw this policy, and I didn't hear anything for several weeks. And I thought, well, they just said no. And then her team reached out to me, thought that this would be an interesting way for her to get this message out and to focus on an audience of doctors trained in the United States. All you can do is ask, and all they can say is no. And this is the same for everything that we do in our lives. Is if you have an idea, if you have a business that has a good business proposition, you think, talk to somebody. All they can say is no. If you have a hobby that you want to do, go do it. If you want to change something, go out and try it. There should be nothing that holds you back, because at the end of the day, if the health minister doesn't want to come onto my podcast, or my podcast doesn't ever work out, it doesn't matter. At the end of the day, I'm still going to be a doctor who has a wonderful practice and a wonderful family. This has been a true honor for me, and I hope that this is a harbinger of great things to come. If you want to move to British Columbia, you've got your answers on how to do it now. Give it a shot. Thank you for listening to another episode of the Interesting MD podcast. Please check out my content on YouTube at Interesting MD, and follow me on TikTok, Blue Sky, Instagram, Threads, and Facebook at The Interesting MD, and on X at Interesting MD. If you have comments or questions and want to get in touch with me or any of my guests, please DM me on socials or email me at rob@interestingmd.com. If you have any ideas for a show and you want to share your hobbies with me, or don't know where to get started on your own project, you can email ideas@interestingmd.com. Please like and subscribe to the podcast and YouTube channel to get the latest content. Much appreciation to Falter Media for editing, producing, and posting all Interesting MD content. Check them out, because if they can do this for me, imagine what they can do for you. See you next week.